It's a very relaxed, very laid back, more like a physician's office.
The wound clinic here at Hillcrest is a multi-specialty group that takes care of wounds all over the body, whether they're surgical wounds from recent surgery or diabetic wounds. There are other causes of wounds, venous insufficiency, as well as arterial disease, which we see often also. Typically it's an outpatient clinic. Sometimes they're referred from the hospitalist here as an inpatient if they were seen on the floor. Other times it is their primary care doctor who likes to send them over, or the surgeon who may have a difficult time healing the wound that they've developed.
The most invasive thing we do is take their vitals. The doctor comes in, looks at their wound. He's very, very good. All of our physicians are wonderful about explaining procedures to patients. They have wonderful bedside manner.
The most common thing I see is a diabetic ulceration. Diabetics lose the sensation in their feet, and they oftentimes have deformities in the feet that creates pressure points that develops callus and ulcerations. The ulcerations can become infected and need further aggressive care here in the wound care clinic to get those to heal. Most
people come in here and say, wow, I didn't know this could be done. Wow, I didn't know this was available.
Well, there's a lot of advancement in regards to wound care products, and we stay up on those quite frequently. More so, I think, is aggressive prevention, correcting some of the deformities that may be present that may be pushing that patient to a diabetic ulceration. Sometimes correcting that can get rid of the underlying ulceration. And we're lucky to be able to work with OHI and some of the vascular surgeons over there to reperfuse limbs or increase the blood flow to the area that will enable us to do some things from a wound care standpoint to help prevent bone infection and amputation.
We have had one gentleman that he was going to have his leg amputated, and he was told there was no other option. And he came here and we didn't have to amputate anything. I treated his wound resolved. That's definitely the best case scenario. We try to reassure them and let them know that, we will be calling your home health. We will follow up with your primary care or whoever has referred them here to make sure that they know everyone's involved, everyone's on the same page. Most home healths have my phone number. They can call anytime they need to, especially if it's a new patient. We'll always phone to follow up and make sure that everybody knows what's going on.